Creating a system built on prevention, trust, and stabilization requires more than one idea. It takes collaboration. So, who has a stake in changing how we support families? These are the individuals most directly impacted: families seeking safe support, children who benefit from stability, and responders who provide frontline care. These groups interact with family crises every day and would see shifts in workload, referrals, and outcomes. These stakeholders influence whether models like this can be funded, implemented, and sustained. Families receive help earlier, children experience less disruption, and systems can focus on the most serious cases. Some may question cost, accountability, or whether shifting away from investigation first changes outcomes. These concerns are part of the conversation. Real systems change must center the voices of families while also including those working within the system. Collaboration across systems is what makes prevention work. Safe Harbor Front Door Care Module, because no family should be afraid to ask for help. I want to start with a feeling most parents know, but rarely say out loud. Stress that hums in the background, bills due, a fridge that's not full, a school email you don't know how to answer, a toddler who stopped talking at daycare, and under it all, the fear that asking for help could make everything worse. What if asking for help did not feel like risking your child? Right now, families often avoid reaching out because they're scared a knock at the door could turn into an investigation. Systems step in late, after a crisis, then sift through damage that could have been prevented. Workers are overwhelmed, parents shut down, kids absorb the stress, everyone loses. So I built something different. I created the Safe Harbor Front Door Care Module. It's a new first step for families, a front door where the default isn't investigate, it's stabilize. Here's how it works. You can reach Safe Harbor voluntarily, by phone, text, online, or through a community partner you already trust, a school counselor, clinic, shelter, pastor, neighbor. No sirens, no gotcha questions, just one clear promise: stabilization over investigation. From the moment you reach out, we triage within hours, not weeks. A short conversation to understand what's urgent: safety, housing, food, utilities, childcare, mental health, school supports. Then, within 24 to 72 hours, real help arrives. This is where the new workforce comes in: family welfare crisis responders. They're trained through an apprenticeship model, on the job, side by side with seasoned mentors, in trauma-informed care, crisis de-escalation, child development, assessment without judgment, nuts and bolts of local resources. Think EMS energy, but for family stress. Visualize it. A responder meets you where you are: your living room, a school office, a clinic, a library, wherever feels safe. They listen first. They ask, what would make the next 72 hours easier? Then they roll up their sleeves. Housing? They line up a short-term motel voucher or a rapid rehousing referral. Food? Same-day delivery or a direct connection to a pantry with extended hours. Utilities? Emergency funds and the call to negotiate a payment plan. Mental health? Warm handoffs to community counseling with telehealth options and sliding scale. School? Coordination with teachers, IEP support, attendance plans, transportation. They don't investigate you, they stabilize with you. No case number unless you want ongoing services. No automatic hotline unless there's imminent danger. It's consent-based, time-bound, and practical. The philosophy is simple. When basic needs are met quickly, risk goes down. When parents feel seen, they're more likely to accept help. When help shows up early, child protection doesn't have to. What changes when we lead with stabilization? Families ask for help sooner, because the front door is safe. Kids stay with the people they love, because crises get contained before they spiral. CPS gets to focus on serious harm, because the constant flood of preventable cases slows. And trust, between families, schools, clinics, and community, starts to grow again. Inside Safe Harbor, the workflow is tight. intake in minutes, triage in hours, support in 24 to 72 hours, a stabilization plan that's written with you, not for you, a follow-up call at day 7 and day 30 to close the loop or extend support if needed. No family should be afraid to ask for help. Not here, not now, not ever. Safe harbor. Front door care module, prevention, trust, stabilization, support. Stakeholders and benefits. A simple promise. Stabilization over investigation reshapes the system. Families faster, voluntary help, lower stress, clear next steps, children and youth stability at home, fewer disruptions, safer days, schools and clinics, a safe referral path, quicker supports, reduced crisis load, child protection, fewer preventable cases, focus on serious harm, better outcomes, family welfare, crisis responders, apprenticeship training, real-time impact, career pathways, policymakers and funders, cost-effective prevention, transparent metrics, public trust, health systems, early de-escalation, reduced ER visits, integrated care, community partners, warm handoffs, shared language, stronger networks, researchers and evaluators, clear baselines, rapid learning, scalable models, equity access without fear, consent-based support, dignity first, system benefits, intake in minutes, triage in hours, support in 24/72. When the front door is safe, people use it. Trust grows. Safe harbor. Front door care module prevention. Trust. Stabilization. Support.